makes you feel elated to know that you are the difference out there between life and death.
I don't think any other career is going to give you that kind of reward. Deep breath in.
It's exhilarating. You get up in the morning not knowing who you're going to go to, what you're going to treat, who you're going to see.
My friends think it's great, probably looking at me and thinking, God, I'm so jealous.
When you walk through that door, you can see the hope in patients' eyes.
I personally think it's one of the best jobs in the world.
I've got the tube.
The tube goes
Tube
in.
is past the cord, so bougie out, please.
Bougie's away.
So patients who have a problem with their airway, lubrication is very important. These are patients who are critically ill, who need an airway intervention as quickly and as safely as possible. Putting equipment in that doesn't have lubrication raises the chance of the equipment not going into the right place in the right time, and if it does go into the right place, it may not sit correctly. So effectively, we need to be able to put those devices in a smooth manner with as little complication as possible, and lube allows us to do that. There's always a risk when we're putting a device into somebody's mouth or into their throat that we can cause trauma, and lube in effect does help minimise that risk. In A&E we use lubrication in quite the same way for our patients with airway problems. We have other devices as well that we may use in patients who are not as poorly but require some sort of help, and lube, nasopharyngeal airways as well, and things like that a patient can tolerate when they're conscious. We would use lube for that.
Set then? Here's something that's going to make you a little lightheaded.
In anaesthetics, I use lubricating gels in a range of procedures and pieces of equipment. I use lubricating gel to aid passage of these disposable pieces of equipment across mucous membranes.
So here's the one that puts you off to sleep. It makes passing, for example, endotracheal tubes more straightforward. It also causes less pain and discomfort to the patients. There's less bleeding from mucous membranes, and the patients are more comfortable after their operation.
He's been an absolutely brilliant patient and doing very well in terms of being comfortable throughout the procedure. All endoscopes are disinfected and decontaminated to a very high level before they're inserted into the body. And of course that would all be ruined by using some dirty piece of gel to put on the outside of it before you insert the tube. In the same way, single use is completely mandatory really, and it would be utterly inappropriate to reuse any of that lubricant and completely contravene all of the standards of decontamination that are ingrained in the practice of gastroenterology and endoscopy in particular.